like to thank also the presenters who went before me. I thought that I'm a student of innovation, and innovation often comes from borrowing from either other countries or other sectors. And I thought that that was a terrific borrow or melding of game theory with the kinds of work that the people in this room do, and I thought it was really terrific. I also want to just take 1 minute, or probably not even a minute, to thank Daniel Stein and Vernon Brown for their founding of the Stewards of Change and the Stewards of Change Institute, and of course all their esteemed colleagues and their families who have supported this organization and this symposium over the last 10 years. Can't believe it's been 10 years, but it has. And I think that I'd also just like to thank everybody in this room. Everybody in this room works really hard every day to improve the lives of the people in our country, particularly those people who are the most vulnerable people in our society. And I know that many people here could have jobs that are much more lucrative, but everybody's dedicated to this mission, and I just think that it's wonderful, and I want to thank you on behalf of the country, as if I had that ability to do that, but I do, and I think we also have an extraordinary opportunity. The opportunity that we've been talking about yesterday and today is extraordinary. We have the opportunity to really change the way that human services is organized and paid for in this country. And I think that we're making progress on that. And I think that from the time that I still had blonde hair instead of white hair, I've been working on things like integrated services, and we never called it interoperability in those days, but I think that was the same thing. Let's see. Let me just make sure I can do this. So I'm going to talk about Casebook and Case Commons. Case Commons is the private nonprofit that was spun off from the Annie Casey Foundation in 2010. And in the early days of the Stewards for Change, Daniel and I and others had these very big ideas about using technology to transform human services. It's something that we and many of us are very passionate about. And at one of them, pretty early on, I was a funder, being from the Annie Casey Foundation, where, by the way, I still work. I was a funder, so I got to open it with Daniel. And I think it was the first time that, I'm not sure about this, but I think it was the first time that Daniel introduced the idea of interoperability. And I listened and I was, yes, that's right. And I also had stopped to see my daughter on the way up to the conference at Yale, and I saw her Facebook page for the first time. This is like 4 hours before the conference begins. And I'm totally fascinated with the social networking. Remember back to innovation, I borrowed from social networking, and I was like so excited, which is one of the good and bad things about me. But I go up to the conference, and Daniel makes this great opening, and I get up there and I say, I think we should not only be talking about optimability, but I think we should be talking about using social networking technology, and we should have something called Casebook. And I'm so excited. I think that everybody's just going to start clapping and saying what a great idea, and it falls in the middle of the room like a huge lead balloon. I don't think anyone knew what I was talking about, and I'd realized that I'd made this terrible mistake. But I persevered, as did Daniel, and Stewards and Vernon and everybody. And I persevered and talked my foundation into funding a beta for something that is now Casebook. And we all know that that information is power. We use it all over our lives and every day of our lives, and technology fuels that information, as we heard a lot about yesterday. And we heard a lot also about very big ideas, very big visions. We heard a lot about very big data and what we can do with big data. And there's no doubt in my mind, or anyone else's, that we need to connect data sets to understand much more about our vulnerable populations and what we can do to move people to be productive citizens, to be alive, healthy, educated, and productive citizens of our society. But we also must talk about the need to get better technology and better tools into the hands of the frontline human services workers, no matter what type of human services workers they are. In child welfare, which we've been talking a little bit about this afternoon, our country's frontline workers are the ones who have to go out in the middle of the night. They often go out, as was pointed out, with very little information about the door that they're going to knock on and who's behind it, other than an allegation that's come into a hotline. And they also, once they get in, have to make one of the most amazingly profound decisions that our society has to make about a family and about a child. The decision to remove the child from their family and from their home. And for anybody who has children, you can just imagine what that would be like. Child welfare workers then have to plan how, the service plan for how that child will either go back home, get the services with their family, to go back home, or how they will proceed to other kind of permanence, meaning usually adoption. And they make these plans with very little data. They rely on what the families told them, and they rely on what they can get from other agencies through the telephone, or maybe through reports. Maybe there's old court reports. Maybe there's an old file someplace. There's very little, despite the fact that the information systems that we've had since the 90s were terrific in the 1990s. They were really the most advanced systems. They're a little bit outdated, and workers put very little into them. They keep things in notebooks. And so when they leave the agency, the notebooks walk out the door with them. And so they have very little data on which to make these plans. We think, and I'm sure everybody in this room agrees, that they need and they deserve the best and the most cutting-edge technology that we have in our country in order to give them, in real time, all the data that they need from every source that they can get it, to plan the services that that family needs so that they can either get their kids back, or if it's in the best interest of the child, move to adoption. So human services policymakers have also got to have access to the highest quality data. They have to understand the trends, they have to understand the needs that their agencies have, and they have to make decisions about the most critical programs that either have to be funded or not funded. Sometimes the hardest decisions that they have to make. And the truth is that very few people in human services have the cutting edge tools, and virtually no one has real-time data. So this is a slide of, I don't know if you can see the data, it's dummy data anyway, but this is Casebook. Casebook is sized properly for any tablet. It's totally mobile. And what is really important about this in relation to what I was talking about before is that this technology that I was talking about, the best and most cutting edge, actually does exist. It's available right now, and it's the same kind of technology that all of us use in our everyday lives. We totally take it for granted, and we want it to be available to human services workers so they can take it totally for granted in their work as well. And I'm going to give you now a glimpse of what it is. But first, I'm going to talk about a little bit of history. You might remember that this is the first generation of data systems that we had in our country for child welfare and other human services. And I wanted to say that there's 3 states, at least, that I've been in recently who still use these and still have to memorize all the codes that you put in to input the data. So imagine they don't get the data out of it, right? They put it in because they have to, but they don't get it out. This one is showing the next generation of, and these are all child welfare, SACWIS systems, or SACWIS eligible systems that existed. And these were client-server systems. And then the third type is systems that have been built with a web-based front end. So these systems, these are examples of systems. So these are systems where you can access them. You don't have to go back to the office to a terminal, but you can access them from places where you have an internet connection. But the data has to travel back to the state system, let's just call it, and go into the right place, and then the uploading and downloading is quite time-consuming. One worker in New York told me that she does jumping jacks while she's waiting for the data to travel back and forth. And so these are the systems. Again, I want to say that they were great when they came out, but we've moved beyond that. The federal government is really, I think, moving forward. We've heard a lot about that today. They are really trying to lead us and help support the kinds of technology that we need. I'm not going to talk about all that they've done because I think we've heard a lot. I don't know that we've heard as much about child welfare, but I'm happy to talk about it. I'm going to go to the next one. Uh-oh. I went too far, I think. Oop. There we go. And the idea, I think I missed one. Yeah. So what we've developed with Casebook is a different approach to the ones that I just showed you. They look, feel, and are very intuitive, just like the internet applications that most of us use, and the ones, I might add, that the young workers that are coming into child welfare systems and other human services are used to using. When they see those other kind of systems, some of them just getting out of college have never seen those kind of systems before, and we know that they have a very high churn rate in these systems. And so we've also designed the system so that it is a person-centric system. What you see here is a person page. Every single person in Casebook has a person page. So a doctor has a person page. A mom has a person page. A dad, everybody has a person page. And if they're related to a family, then they right away populate a network page, a family network page. The worker puts in the information which is required, and it shows up right in the network and with the phone numbers, so they're really easy to find, and that makes it much easier to contact people if you have to contact them. We've got their emails, their phone numbers, so that they can be texted. And this makes it much easier for people to find the kinship care, the doctor, to get the reports. Everything's electronic. You can upload photographs. Some places they're almost always required for children. Sometimes they're discretionary for adults, but we found that lots of people do it. They can take photographs. The workers can take photographs of important documents and upload them, and then they'll always have them. The immunization records can be uploaded and then printed and taken to schools so that the kids don't have to wait or get re-immunized so they can go back to school. And so this is real technology. It's in use today in the state of Indiana. It is the case management part of the replacement of their SEC eligible system called ICWIS. We signed a contract with them in 2010, and we went live in July of 2012. That is 2 years. And so we built it and put it in place, configured it and put it in place in 2 years, which is quite fast. We have a 99.9% uptime, planned uptime. We do deploy in the middle of the night. Casebook is built on the web for the web. It's not a front end. It's the front end and the back end of the system. And this is the kind of software, this intuitive, easy to use software with all kinds of electronic capabilities is what we believe that everybody needs. Whether it's Casebook or not, this kind of technology is what we need and what I believe is coming. And we might as well get there fast. It's also, by the way, much less costly. And so I want to show you one more thing, which is this is the worker homepage. I don't know whether you can read this, but in the first, what we've tried to do is take 3 metrics. We've built in a lot of metrics into Casebook. I'm only going to show you this. This is when a worker logs in. The first thing that the worker sees, the caseworker sees, is 3 metrics that are really important, that are evidence-based or evidence-influenced, that are very important to child safety, permanence, and not languishing in foster care. The first one is how many days has it been since the child had adult worker eyes laid on that child. So we've all heard horrible cases about children being hurt or dying, and nobody has seen the child for way too long. So this just reminds the worker. There's no tickler. There's been no policy change in Indiana since this was implemented, and we've seen the number of home visits within 30 days go up. I'm not at liberty to share the data with you, but it has gone up. The second one is, so that's safety. Second one's permanence. We know that this measures family home visits. I'm sorry, not family home visits. Parent visits with children. We know that if children visit with their parents often while they're in foster care, the chances of successful reunification go way up. And so we have seen this metric when workers have, the same thing, when workers see that it's been a long time since they visited a family, they do it, and we have seen this double. And the third one is the number of days until the next court appearance. If workers know that there's a court appearance, there has to be one every 6 months. If they see when it's coming, they get ready earlier, and there's a far less chance that the court date will be postponed, and children will languish in foster care because of no other reason other than the postponement, because people weren't ready. So what we have to address, and what we've been talking about in this room, is these silos, or as we heard about this morning, the cylinders of excellence. We have to figure out how to make these cylinders of excellence work better together. And we've made strides in that, and we've talked a lot about the big data that we can, and data sets that we can pull from all these, and we can get more information to people, but we have to figure out how to get the data back to the workers who are doing the work with the families. So what this shows is that we all collect a lot of the same data. Many verticals, easier to say, verticals collect demographics. They collect all kinds of the same information, eligibility information. Maybe it's different from different agencies, but we all collect it. We all collect, many agencies do social histories. A good social history takes about 40 hours to complete. I worked in juvenile justice for a long time before I worked in child welfare and children's mental health. And these are incredibly detailed social histories. And so if we could share with appropriate privacy, with appropriate confidentiality provisions, then that would save us an enormous amount of work. And I think that it would also enable the family to get better services, because everybody can talk to each other. They could talk to each other electronically. The idea in the beginning was that people, just like in Facebook, people can become friends and make a group. The idea is that they could become members of a case with role-based security, with all the provisions that we know technology makes available. They can become members of the case and develop maybe 1 or 2 service plans instead of 6 or 7. And so that is where we should what we should think about when we look at these verticals. And this is a way that we reimagine what those human services really could look at. This, you might not be able to see, but it says all the shared data and demographics. You could have, in the next ring, you could have a shared service plan, and then you could share some of those service plans across agencies with members of the case, so that the family has as few service plans as possible, and they do not have to take hopefully 6 buses to 6 different agencies so that they can get the services that they need, because we've figured out how to do a lot of these things electronically to support the workers who can support the families. And so I think that's the reimagining that we're talking about, that I think is not at all contrary to the big data that we've been talking about, or to the epidemiological understanding that we all believe is really important. This is a different kind of vision, but it's also a very big vision, because very few people in the country have this kind of technology in human services. I have not, we didn't have time today for me to talk about analytics, but I just want to say that all those metrics, plus many more, can be rolled up, and they would knock your socks off. I mean, the analytics that we have developed are among the best that I've seen in the country for human services. And with that, I want to thank you.
So, stay up. Okay, so this is an Ignite session. Anybody got a burning question? Right, Ignite? Okay. So, quick question. We got five minutes. Why don't you stay at there or pick up a microphone? Anybody got a quick question? My comment really is I really love the idea that you're building in the standards, for child welfare.
Thanks.
Hi, my name is Kathleen Gonzalez. I'm a social psychologist for the National Council of Juvenile and Family Court Judges. So I'm very interested in your juvenile justice element there. So with Indiana being your pilot, from my understanding, have any judges or probation officers or anybody that's critical to that element been added as case members?
So let me just say that the children who are in juvenile justice, who are in residential care or foster care, are in the system. So all the probation officers who have children at home are not in the, they don't use Casebook. They have their own system. I think that will eventually, they will migrate over to this, but I can't remember, I want to say 91 counties, 91 judges in Indiana, and I think that it's just taking a while. I think that was the original vision of Casebook. And I also want to say that the only other people who are quote unquote professional members of the case are people who have children from private agencies who have children in the custody of the state. So we don't have doctors yet. We don't have teachers. We're not doing all that data sharing that I want us to do yet, although I believe it will come.
This is going to have to be the last question.
Sorry.
I was interested in what the workers' response have been to using this system, and have they reported any difficulties or issues that they wish were resolved?
So we are always, I'm going to try to do this really fast. We built Casebook in a very different, not waterfall way, for those of you who know about technology, but an iterative way. So we used workers every week, and we got feedback every week. We continue to do that. We continue as we roll out new features to check with them. So that's one answer. Yes, we are always improving it. The second answer is we only have had two surveys, one before we started, and one that was when the system had only been in use in 13 months, and we saw about a 20% increase in the category of people feeling like it really helped them do their work better and faster. We have now been going for more than 2 years, 12, 15, almost 3 years, so we're going to do another survey, so I'll be able to give you better data in 6 months.